Broadcast is now starting. All attendees are in listen-only mode.
Well, hello, and thank you for joining us today. My name is Jennifer Warnke, and I am with First Dragon and Computers Made Effective. And today I also have Dana Allison, the CEO of I'm Your Doc, here with me to demonstrate their HIPAA-compliant secure messaging app and their newest feature with video and telehealth. We're going to go ahead and get started in just a couple of minutes to give everyone a chance to log on. So I will come back in about 3 minutes and we'll get started. Okay, so let's go ahead and get started. I see that we have our participants on. If anybody joins us, they can join right in. I'm going to be going through some information and then I'll introduce Dana. As I said, she's going to be joining us from I'm Your Doc to give us a demonstration of the app and also of the new video capabilities and the telehealth capabilities. And then we'll have an opportunity to ask questions, which you can do at any time. You can text or write in a question and we'll answer that during the question and answer period. So let's go ahead and get started. So today we're going to be talking a little bit about Computers Made Effective and what our client objectives are. I'm also going to be discussing this new application that we've brought on board. We're really excited to be partnering with I Am Your Doc, which also happens to work alongside Dragon Medical. It's a real-time mobile messaging application and it is also fully HIPAA compliant. So we're going to discuss that app. You're going to get a demonstration, and we're also going to show you some cool ways that it works with Dragon Medical. And then we'll have an opportunity for questions and answers. So a little bit about First Dragon and Computers Made Effective. We have been in the speech technology industry for 20 years. We specialize in service. That is our #1 goal, is to bring products to you that help save you time in your practice and increase your productivity. We are also happy to be the #1 Nuance partner for Dragon Medical One deployment in 2018, and we continue into 2019 as well. So that is a point of pride for us. And as I said, our first priority is service for our practitioners, and we are always here to help when anyone has a question or needs assistance, and that is something that comes along with our service. We have a new partnership, like I said, that we're very proud to introduce, and that is with I'm Your Doc, and that is a secure messaging app. And we're going to be going through those features of that app today. And as I said, our client objectives, one of them is to help increase practice productivity through documentation, helping doctors document and faster. And they can also do that now through I'm Your Doc with secure messaging. And one of the things that, like I said, we're very proud of is our customer satisfaction. We have a very high customer satisfaction rating because we're always here to help customize our solutions to fit the needs of the practitioner. So whatever your work pattern is, we're here to help customize that, help you work within your EHR. And the great thing about our new product is that it also can provide some peace of mind because it's fully HIPAA compliant, just like Dragon Medical. So why secure messaging? Why is that something that we're interested in? Well, today, most people actually are working on a mobile device. And the I Am Your happens to mimic most industries' mobile consumer experiences. So it's real-time notifications that look just like and feel just like a text message, which is very convenient, but also provides that security that is required for practitioners. So it's HIPAA compliant. And it's easy to install, it's easy to start to get up and running, and it's a simple user interface, which you're going to see when Dina goes ahead and demos that for us today. You'll see just how easy it is to use. So no big time chunk to get up and running, something that you can get up and running with fairly easily. And just like most of us use our mobile devices, most of us use it for banking, ordering food, even grocery shopping these days. We use it for social media, we read on it, we play games on our mobile device. The one thing that's been lacking is for healthcare providers to be able to communicate on that in a secure environment. And that's one of the things that I Am Your Doc does, is it brings that experience to your smartphone, but also to your desktop as well. So it is a cloud-based encryption that allows you to communicate inside and outside your network. It's cross-platform, which means that you can use any of your devices. You can use your smartphone or iPad or your desktop computer. There's no more delay in phone tag or delayed communications, because everything is real time. You're able to get a notification on your device when you have a new message, and Dana's going to demonstrate that. And the great thing about working with Computers Made Effective is we're going to be able to help you get up and running with it, and also it does work very well. It's a nice complement to Dragon Medical. So whether you're working on Dragon Medical Practice Edition 4 or Dragon Medical 1, you're going to be able to use I'm Your Doc with and alongside that. And I'm going to go over some ways that you'll be able to do that in just a few minutes. So a great thing about I'm Your Doc also is you're going to be able to, and you can see on the screen, you can attach photos, and you can easily download transcripts into your EHR EMR. You'll be able to securely share messages, which means you're not going to have those stored on your mobile device, but they will be in the cloud. You can also use voice to text on your mobile device, but also voice to text. You can use your Dragon Medical when you're on your PC. And one additional benefit is that messages are archived for 7 years. So that's great in case of audit, or in case you need to look back at messages that have gone back and forth between providers. And it is just one of the added benefits. And how can you use I Am Your Doc with Dragon Medical? So we can improve your I'm Your Doc experience by combining it with Dragon Medical, so that you can use your speech to text feature especially when you're on your Windows computer. You can dictate secure text into your messages, and you can use your auto text library. So the full library of auto text that you have saved, when you have a phrase that you insert, maybe text chunks, conditions, things that you would have to normally type out, or that would be a larger, more intricate chunk of text, you can actually just use your auto text feature and insert that just like you would in Dragon Medical. And so that's going to obviously increase your speed and productivity when you're messaging, and even when you're messaging on the go. So at this point, I did want to introduce Dana, and like I said, she is the CEO, and she is here to demonstrate I'm Your Doc, including their newest feature of video and telehealth. And so At this point, I would love to give Dana the reins. I'm going to go ahead and change presenters to her and let her introduce herself.
Hi, everybody. Thanks for the introduction, Jennifer. That was great. It gave a good overview of I'm Your Doc. Obviously, it's easier to see it in real time so that you can see how it would actually work at your practice. And while we're switching that over to my screen, I will just talk generally about I'm Your Doc, and then let me know if you have any questions as we go through the question mechanism in GoToMeetings, and then I'll be happy to answer or demonstrate anything that I don't touch on. I'll just briefly go over the general usage of I'm Your Doc, talk about some of the use cases that it answers. The benefit of I'm Your Doc is it is on mobile devices or computers. So most of the clinicians use it on their mobile devices almost 100% of the time. But you also have the web version, similar to like a Facebook Messenger, in which you're able to then also use it on the computer if you're a front office person or a support staff who's mostly on their computer modules for the day. Jennifer, you switch that over to me?
Yeah, I'm doing that now. I'm sorry, I had just a little bit of technical difficulties, and we are now. There we go. Yep. All right. Great.
So on the screen itself, you can see the web version that I was talking about. We don't actually run or install anything on your computers. It's all web-based, which makes it convenient. I'm running this in Chrome right now. It can be Internet Explorer, Safari, Mozilla, whatever you run in your practices or at home. And this is what it would look like. So we have gone to great lengths to make it look and feel like a regular messenger that you use in your everyday life. And then under the sheets is where all the compliance and the HIPAA requirements are met. On the phone, which you can see my iPhone here, although as Jennifer mentioned, it's iPhone or Android device. You can also use tablets or iPads as well. It is a native application, as you can see right there in the bottom right corner of my phone. That means that you can have it logged in all the time and get real-time notifications that way while maintaining compliance. So what do I mean by that? Well, if I tapped on my iMessage to go directly into the app, it shows my messages, which isn't HIPAA compliant. Obviously, if your spouse or your partner or your kid was on your phone, you obviously don't want them on your device to be able to see any PHI that you may have discussed with your colleagues. So I'm Your Doc is different in which it doesn't require a username and password because that's too onerous and you wouldn't use it for texting. So it has to be easy to do. In this case, I'm going to enter a 4-digit PIN, but in most cases, you can use your biometric fingerprint or your face recognition in the iPhone 10 experience. And so you, just like you would unlock your phone with your fingerprints, you can unlock I'm Your Doc that way. But it also allows you to have to authenticate yourself to get into those messages, but maintains that convenience of not, again, having to be use a username and password. So a good example of a conversation that might happen between clinicians is that there's a limited breath sounds, there's a right lower low problem. Obviously, this can be any sort of clinical situation. You need to talk about it. An X-ray is sent, and then they ask for labs as well. So on I'm Your Doc, you can actually send lab other documents. You can see patient schedules. If you're rounding at the hospital, you can send patient information because, again, it's all compliant. On the mobile side, once I put in my PIN, as you can see, it looks like any sort of messenger that you use. Here's the message thread. There's that PDF of the lab report. So as a user, in most consumer applications, in order to view a PDF, as an example, it downloads to your phone and you use the Adobe Viewer to look at it. But in the case of I'm Your Doc, obviously we don't want to pull it out of the encrypted environment. We want it to stay. And so even though it's small, you can zoom into this lab report and read it very easily as you go through it. And again, this could be a document of any variety. It could be an intake report. It could be a discharge summary. It could be a med list, anything like that that you can attach to the message. And on the phone side, when you get an image, again, you can zoom in and take a look at it fairly easily. And I'll show you what that looks like in live time. So let's send a message so you can see what it looks like. Thanks, let's get her admitted. So you can see you get a real-time message notification just like text message, which is important for responsiveness. That's what's missing in messengers and EHRs or in web-based. So it's right there, and you can see that you can go into it. Now, I've been into I'm Your Doc in the last minute, so it went directly into the message. After a minute, it would require my fingerprint again. And so once I actually opened it, this, for the sender, changed from delivered to read. So there are read verifications on each of the messages once eyes have been laid on it. And that just improves workflow over time. You can imagine how many times medical assistants or you have to sit on the phone on hold waiting for the person to get there, or you leave a voicemail or send an email, you have no idea if it's been seen, so you have to take the time to follow up. And obviously that is a huge annoyance, and where most people are not just abandon and use text message, which they shouldn't. So I'm Your Doc allows you to, in real time, get a read verification. Now, the benefit is, obviously, when you're a desktop user, for instance, if this was a scheduler communicating with a physician or a medical assistant in the back office, or maybe they're at the hospital doing rounds, I can be logged into I'm Your Doc and actually have a message sent to me and still get a real-time notification. So you can see I get a push notification even on my computer, even though I'm not looking at I'm Your Doc. This stays, so it doesn't disappear. So if you got up to go, do a copy or pick up a fax, when I come back, I will see that I have a message waiting for me. And you can see on the sender side, again, there's the delivered. Once I actually take a look at it, the push notification disappears and this changes that it's been read. So you get all the same behaviors of text messaging with a few instances that help to benefit your workflows in your practice. You can also use it for non-clinical communication, including announcements. So you can use it for group messaging. This can be for clinical or non-clinical. In this case, announcements is a group that I set up as an administrator, and I want to send a message out to multiple people in my practice. This could be 50, 100, 200, 22, doesn't matter. And by naming my groups, if it's a recall group that I would be using a lot, for instance, my front office staff, front desk staff, schedulers, billers, my nurses, those kinds of things, you can set up group names. You can also set up care teams around patients and name that group by the patient name. So in this case, we named this group Maxwell because the last name of the patient is James Maxwell, and the MA, the specialist, and maybe the family care doc who are all taking care of that patient are on that message so that everyone's in the know. So in this case, these are non-clinical communications but are necessary to improve overall practice communication. Don't forget the all-staff training meeting. We'll let everyone know when our system is down. We'll let everyone know when it comes back up. And the benefit of group messaging as well, we'll send a message here. So you heard that a sound. You see the new message that's arrived. And the good thing about I'm Your Doc group messaging is that each individual user on that group message will get an individual read status. And that's important, obviously, if this is a clinical communication, like Mrs. Jones was just admitted into the ER. Please follow up with her when she gets out, right? And you want to make sure that that message is actually being seen. So in this case, Lawrence has looked at it, and now we're going to take a look at it on Mark Hamill's side, and sure enough, he's read it too. So as the individual looks at the message, it live updates read statuses so you can make sure that each member of the group has seen it, the pertinent part of the message. And as I mentioned, you can also send images through I'm Your Doc that stay in the HIPAA-compliant environment. So we talked about attachments. On the phone side, you don't have documents stored on your phone, at least you shouldn't. And so in the case of images, we see images being used in multiple cases. Sometimes it's being taken, for instance, like this, where you can see an incision. Sometimes it's of a computer screen that has a lab report, and the doc said, I need to see the stat lab report, but I'm headed to the hospital. Can you IMY it? Can you IMY doc it to me as soon as it gets there? They can take a picture of the computer screen. Sometimes it's taking pictures from a document on the desk, like an intake report or a med list or whatever the case is. So images, we see images being passed over IMY doc constantly. And when you do that, you can see if you choose camera and use it with IMY doc, I'll take a picture of my keyboard here. It's all in HDR, and unlike WhatsApp, Facebook Messenger, iMessage, etc., this picture is not stored anywhere on the device. So unlike those where you can then go into your camera roll or gallery and see that, this stays in the HIPAA-compliant environment, which of course is important for the HIPAA rules. And when you zoom in, it's all in HDR, so much so that you can see the depth between my keyboard. And so if this is an image of a document or a computer screen or a rash or incision, it will send the appropriate information very quickly. Now, IMY doc not only is for provider communication or in-practice communication, but it's also for patients. And so patients can also send images like this that are helpful for you to make clinical diagnoses, to follow up with them after they've been seen, for them to tell you that they've been to the ER and they got a new medication, and take a picture of the med list or the discharge summary so you have that information. So patients can communicate with your practice, and practice can communicate with the patient very easily. And James is bright red because he is a patient. So there's a mechanism for you to discern my colleague versus a patient communication. That's important. And now Telemed has expanded its billing codes enormously in 2019. And the question is, do we invest in a complex telemed solution? How do patients like to communicate with our practice? How do I like to communicate with my patients? And you can see the video icon at the top of this discussion. Now, patients do not have it on their side, so we don't want them initiating any video consults as an example. But in the case of providers, I can, if I'm talking about your kid's rash with you, I can initiate a quick 5 to 7 minute video consult to take a look at that rash. And then on the same platform, I can then follow up the next day to get a picture of it to see if it's been progressed. So it hits all the marks in terms of patient engagement as well, sending them post-op instructions so that they know what to do, sending them pre-op instructions, sending them information about type 2 diabetes, those kinds of things. And so when you have a video call, and I'll just initiate one so you can see what it looks like, it will look like just like any other video call mechanism that you are used to. They get an incoming call, looks and feels like FaceTime, but it's surrounded by code that makes it HIPAA compliant. I can answer it or decline it. I'm going to decline it so you can see that, what it looks like here. And you can see that Louise Trout declined your video consult. In the case when it was actually accepted, I'll show you what that looks like. What we document is the beginning of the call, the end of the call, and the duration of the call. And this can be put into a PDF, or if you are one of our partner EHR practices, you can also put it directly into the EHR through integration. So that way you can then add an encounter note around it and actually bill for that consult, which will start generating some revenue for your organization. I know that the time is short. There's obviously many more things we could show and talk about perhaps in the next webinar, but I definitely want to open it up to questions.
Great, yeah, and if anyone has any questions, now would be a great time to go ahead and ask them. And you can do that in the web chat if you do. I know one question that's come up, Dana, is the integration with EHRs. And I know that it works alongside any EHR, but is it integrated into certain EHRs at this point?
Yeah, so our partner EHR programs are CPS and CEMR, which is Centricity or Verint. So we are directly integrated with them. as well as Greenway, so Prime Suite and Intergy EHR platforms. In any of those cases, if you have that EHR platform, you can actually select this clinical conversation as an example that you want to get into the chart and export it to EMR. So if you do not have one of those EHR platforms, you can still move this clinical conversation into the chart by exporting it as a PDF and attaching it to the chart. So either way will work in terms of integration.
Oh, it's great. Okay, excellent. So will I Am Your Doc work? I have a question. Let's see. Is eClinical EHR an option? That's one of the questions.
We're not partnered with them today. It's always an option because we can integrate with virtually any EHR platform. But today, it would take a little more work to get a custom integration built with them today because we're not currently their partner, is the short answer.
Okay, so, but you could transfer those files by PDF into the EHR charts, just like you said. Okay, great. And so another question is, so no images are stored on a device?
That's correct. Everything is maintained within the HIPAA-compliant environment, whether a patient sends your practice an image or you send images amongst one another as your healthcare staff. Everything stays within the encrypted environment, including this PDF. So you can be safe to use your own individual devices and still maintain HIPAA compliance.
Great. Okay, so yeah, no extra devices are required to be purchased or anything like that. Okay, and the last question is, does it work in Puerto Rico?
The answer is yes. We have some customers in Puerto Rico,
okay.
And we have multiple languages being used with I'm Your Doc.
Okay.
And when you put in either Spanish or the character of Chinese characters or Hebrew, it displays appropriately in the application. So you can use Spanish, no problem, in Puerto Rico.
Oh, that's good to know. Okay, excellent. All right. So Dana, I'm going to switch back into my mode here. From if there's anything else, was there anything else that you wanted to go over before I switch back?
No, I think those are the basic functionalities. Obviously, there's administrative functions, how to onboard patients and your staff. You have control over the communications. If you terminate someone, obviously you want to control that information. And so with a single click of a button as an administrator, you can disable their account. You maintain their records, as Jennifer mentioned, for up to 7 years, but they no longer have access to that. So it gives you a great amount of control over the accounts and the information contained in their application.
Excellent. Good to know. Okay, so there can be an admin or a super admin who is in control of all of that.
That's exactly right. And there's a simple dashboard that we give to the designated admins, and you can follow your own staff list. And here's that disable button that I mentioned. You can add patients and disable patients and see what their activity is as well as when you invite individual patients into your practice, you can set up templates and things to onboard them easily. So there are lots of things that you have access to through the admin portal.
Oh, excellent. That's a great dashboard. Okay. Well, that has been a really nice introduction to I'm Your Doc. And I think, like you said, Dana, there's a lot more that we could, that we can go over. However, in this short amount of time, the goal was to introduce and to get everybody a chance to see what this new program is all about that we're offering. And during the webinar, one of the things I wanted to offer out to everyone is that you can try it for free. So you can try it before you sign up for a subscription plan to I'm Your Doc, just to see how easy and convenient it is to use. The other thing that we also offer at CME is is a trial for Dragon Medical One, and you could actually try them both at the same time if you'd like. Our technicians can can install those on your system and allow you to get up and running using both of them. Fairly easy. They're both very intuitive products. I know I Am Your Doc is extremely intuitive because if you've used any sort of text messaging, you're going to be able to get up and running with that, as is Dragon Medical One, an extremely user-friendly application. And both of those are available to try for free. All you need to do is reach out to us at Computers Made Effective. And we have on the screen, I have some different numbers that you could call, you can email, or you can either go on to firstdragon.com or computersmadeeffective.com, and we have a contact us page where you can just submit it online, a request as well, and we will get back to you as soon as possible. But we also have quarterly webinars, so I know that we'll be asking Dana back to maybe go into some additional product features in the future. But I thank you so much, Dana, and I would like to just offer out if there's any additional questions, we can answer those now. And I do not see any additional questions, but we will certainly be willing to answer any questions if you email us or submit one of those forms, and we would love to give you a chance to try it out because I know that if you do, you'll love it. So I want to thank everyone today for sticking with us, and at this point I'm going to say thank you for attending, and thank you, Dana, for your great demonstration, and we'll see you next time.